So for those of you that don't know me, I'm Dawn Alvarez. I work in the compliance department with Michelle and the rest of the team. I work actually out of the Lafayette office. I also head up the wellness consulting division of Filice Insurance. And I'm here to talk to you a little bit about how you communicate all of this information to your employees. So it's one thing for you guys to understand all of this, and then a whole other animal to try to get your employees to understand it, right? What we want to cover today is some benchmarking out there and how much or how less your employees actually understand benefits in general. We're going to talk a little bit about what I'm calling the new Benefits 101, kind of things that you're going to need to know going forward now that healthcare reform is in full swing. Communicating that information out to your employees. Things that you should have already communicated. What's next, what's coming down the pipe as far as healthcare reform communications and mandates. We're going to talk about the importance of focused and tailored communications when it comes to employee benefits. Also, some best practices, and we'll talk about some additional resources that could help you with that task. So according to a Kaiser Family Foundation study, you'll see here that in 2012, 44% of employees out there did not know how that healthcare reform impacts them personally. I'm sure it's just as much that this year, if not more. And 47% think that healthcare reform will actually lower the cost for the average American. And that really is the hope, but I don't think we're going to see that first, in the first couple years. On this slide, this shows about, it's a MetLife study, and it talks about the expectations between the employee and the employer. Because as Michelle mentioned in her earlier slides, what is their problem becomes your problem. So the more communication that happens between you and your employees are going to foster a better engagement strategy around your benefits and around your employer organization in general. But you'll see here that 50% of employees out there think that their employers are going to drop coverage or that they're not going to be committed to offering benefits in the future. And those same employers, 77% say that they are committed to offering benefits in the future. In fact, only 12% say that they're not committed. And as Michelle mentioned too, that in our book of business, we haven't had one client say that they're going to drop health insurance. Especially in the Bay Area, there's a fierce competition for talent. So benefits are probably, you're all here because you offer benefits. More than likely, you're going to keep the benefits in place. So the new Benefits 101. So it's really important with everything going on in healthcare reform that we're focusing on the here and the now. Michelle says we're getting information by the hour. That's correct. I mean, this stuff is a frenzy out there of all the information that's going on. So focusing on the here and the now is going to be best when you approach all of these subject matters around benefits to your employees. I can't emphasize this enough. You're going to have to plan for ongoing communication. And we're going to talk a lot about that in future slides. And it's very important. Of course, you have to absorb all the information you learned today, synthesize it, and figure out how it's going to work for your population, and then figure out a way that's going to make it work for your employees to understand. So we can stand up here all day and talk about all the things that you need to know and talk about how the employer mandate works. And I'm going to sit here and tell you have to tell your employees. And you're sitting there going, oh my God, I have 500 things to do. How am I going to add this to my list? Well, somehow, some way, you're going to have to make it simple for you and make it work for your employees. And there's tools out there like social media and newsletters and things like that you're going to have to put some emphasis on in order to get this information out. And you may think, well, social media doesn't really work. We don't really have employees that have computers. You'd be surprised about all those employees that you think aren't very tech savvy. They all have a smartphone. And I can't emphasize enough on this one that social media is going to save you in the future. And it is the future. It's also going to be important for you to understand how the media sets the stage for some of your employee communications going out. So you hear things like Walgreens slashing benefits for all employees. That just creates anxiety, and employees read that and they come to the workplace. You don't communicate anything about benefits, so they're thinking you're going to slash benefits, and it just fosters that mistrust, and it's a no-win on either side. So we're going to talk about how we can help create some custom communications out to your employees. So it's really, really important to have employees know their benefits. In fact, you can title everything going out, Know Your Benefits. And you may think, well, we send stuff all the time. They don't listen to HR. We send an HR email. They just disregard it, right? It's like a thankless job, right? So maybe you could ask your CEO to send it out. Maybe you could ask somebody else to send something out. Just change it up a bit. Think a little bit outside the box and how you can deliver some of this information. Because benefits are extremely complicated. They're overwhelming. And as you can see this chart here, it's just a simple description of a high deductible health plan that most employers think, or employees look at this and they say, oh, this is a low cost plan. I'm going to sign up for it. And then they go to the doctor and they realize they have to pay out of pocket a big expense than their normal copay that they used to be on. And so diagrams like this and your communications are going to be key because most of you are going to be looking at some of these high deductible health plans as a strategy going forward. So this really can visualize the type of plan that employee is on, and not just once at open enrollment, but throughout the year. They're also going to need to know what health insurance, the terminology out there. I mean, we have deductibles, coinsurance, copay, all of these different types of words that people don't really truly know what that means. Even as little as, are you fully insured versus self-insured, and what does that mean for you as an employer? So a lot of things that you can get out throughout the year that can really emphasize the meaning of benefits for your employees. So let's talk a little bit about what you have done or what you should have done. We mentioned this in the earlier slides. Statement of grandfather status, that should already be in place if you have a grandfather plan. The summary of benefits coverage, that should already be in place in your new hire packets, your new enrollment packets, all of that information. There was a COBRA election, the COBRA election notice was updated recently. That actually included wording around the marketplace exchanges. So if you're administering your own COBRA, make sure you have the correct COBRA form. Anyone on the Filice compliance team can help you make sure you have that correct form. Of course, if you are using a TPA, they have this form already in place. And then if you were filing more than 250 W-2s, you were already doing the reporting of that medical cost on there. And a lot of employers were hemming and hawing about, why do we have to do this? This is really difficult. What do we have to report? Employees were getting anxiety that they're going to get taxed on the amount and things like that. So proper communication ahead of time can really head off some of those misconceptions and that mistrust. So what's next? The big granddaddy of them all, the exchange notice. So we're going to talk a little bit about, for those of you that haven't tackled that yet for your employees, what the exchange notice is and what it has to include. First, it has to have information about the marketplace, which is a one-stop shopping to find and compare private health needs, and also to find out if that person is eligible for subsidies. It also has to have a statement informing employees about tax credits. It also has a statement informing employees about receiving coverage through the marketplace and the tax treatment of the employer contribution versus marketplace coverage payments. Information about the employer's current health plan if applicable. Clear as mud, right? The employee's going to get this information and they'll go, oh, I know what this is for. My employer covers me, so I don't get a subsidy, and so I can't go to the exchange. Or, oh, yeah, I know. This means that I can go to the exchange. I mean, they don't know. It looks like a scary form. It's really tough to read. So it's important that you do include information around what the notice is. Also, we're going to talk a little bit more about the exchange notice and how you can help your employees understand what that is. Also, the notice of privacy practices was just updated. And if you're a Filice client, you should already have your updated. It actually just had a few sentences around genetic information. If you don't have that, make sure you get that updated. There is, the requirement is for self-insured plans or anyone that has an FSA, but we do mandate it for all of our employer groups because there really is no downside to having a HIPAA privacy practice notice if you're fully insured. It's just going to protect you a little bit and know that your employees' information is safe. We'll talk about the large employer reporting coming down. Michelle touched on it for the carrier side. This is section 6056 and 6055. This looks really kind of ugly, but I'll go over it hopefully and some of the tools that you're going to need to get this information. And also the W-2 reporting is still for just those employers filing over 250, but we could hear information about that anytime about that going downstream as well. So the exchange notice. So if an employee gets the exchange notice and they have all of these questions and you haven't properly communicated what this exchange notice means for them, are you prepared, again, to answer questions from your employees, or are they going to foster this anxiety inside of them and wonder, why did I get this? What's my employer going to do? So things like they're going to say, can I get coverage through the exchange? And all of these have different answers for different type of demographics in the employer organization. Am I eligible for Medi-Cal or Medicaid? Do I have a choice between the exchange or my employer's plan? Do I get a subsidy? Can I use my subsidy to pay for employer-provided health care? They have all of this misconceptions around what this notice actually is. And so we have really encouraged our employer groups to have cover letters that are attached to these exchange notices. Cover letters that are easy to read. They have maybe a picture, a few short paragraphs. Again, short, concise information to get that information out to the employee. This one in particular is about an employee that is actually already covered on the employer's plan and saying, we actually cover you, we cover most of the cost, therefore you're not eligible to go out to the exchange and receive a subsidy. It simply tells them right there in the first paragraph. This one is for a new employee that may be in their waiting period. So they get this exchange notice. They're not even quite sure what your benefits package is. They just know that they got this scary looking notice that shows eligibility, says they can go to the exchanges, and they're really not quite sure what all of that is about. So this one's explaining that we cover the cost of your insurance coverage. We meet the affordability requirements. You are eligible to enroll on this date. So basically, disregard, the exchange notice doesn't mean much to you unless you're not going to enroll on our plan on your open enrollment date. This cover letter, this happens to a person that actually waived coverage. For whatever reason they waived the coverage, they're going to get this information about you've waived coverage, you're eligible to enroll on our plan effective whatever date, but you're not eligible for a subsidy if you do enroll on the open enrollment date. But it talks about the individual mandate and the fact that they've waived. And then this one I think is probably the most important. It's for the non-eligible employees that are receiving this exchange notice, because you're going to want to help them get out to the exchange and or set up an individual plan. I think and again, it really depends on what information you're trying to get out, what type of employer you are, what type of communication strategy you have. But with all of this information out there, this is probably one of the most important cover letters. And you can see here, they're easy to read. There's a couple sentences, mostly pictures. You're going to hear from the panel, and you heard in the beginning of the presentation, e-individual health. It will actually, you can put a link on some of your cover letters, and it will direct them over to e-individual health, which is a great resource for individual plans or the exchange. Also, when you are delivering this information, you can also go on to Covered California, and there's a lot of brochures and pamphlets that can be included in your dissemination of the information. I know that for my husband's company, they have a lot of variable hour employees as a retail chain. Variable hour employees, they sent one letter a few weeks ago basically stating, we've heard a lot of things in the media. This is Trader Joe's stance. This is how we're doing things. Don't worry, more information to follow. Then 2 weeks later, another letter came talking about what their strategy was going to be and the pamphlet. And then just 3 days ago, another letter saying, we hopefully have given you enough information to understand what our strategy is going forward. So really a series of letters to kind of help create a trust and create that loyalty between the employer and the employee. Whether it was good news or bad news, it's still communication, and the employee knows and is been made aware of what's going on. So the large employer reporting that has to happen. And you're going to be having to get this information from employees, and they're going to want to know why. So again, being very upfront about the requirements, what they mean, and what they mean to the employee as well. So this reporting is due for the 2015 plan year. The first report is going to be due in 2016. As you can see there, there's also these employee statements that need to be furnished. So again, employees receiving information like tax notices creates a lot of anxiety about what it means to them. So having the information scaled down so that the employee knows what this means and how they're going to deal with it going forward. But take a look at some of this reporting. The employer is required to furnish to the IRS employee's name, address, contact person, and calendar year of reporting, certification as to whether the employer offered its full-time employees and dependents the opportunity to enroll, number of full-time employees for each month during the calendar year, months during the calendar year for which the coverage was available, the employee's share of the lowest cost monthly premium for the employee only, and name and address and tax identification number of the full-time employee during the calendar year and how many months they were covered. Easy, right? You have all that, you can just whip right out and give it to the IRS. In addition to that, if you are a self-insured plan, you have to include everything there, plus the name of the individual enrolled in minimum essential coverage, the name and last known address of the primary insured or other related person who submits the application, the TIN and months of coverage under the policy program, and they also are specifying other information as specified on forms in the instructions. The W-2 reporting, as I mentioned, still is in place for those filing 250 or more W-2s. A lot of employers hem and hawed around this. There was a lot of anxiety, as I mentioned earlier. This can be a great strategy to take advantage of by offering all employees like a total comp statement. You know what, we're putting all this information on your W-2. This is your share of the benefits. This is our share. So some of these things that you have to report and that you have to give, like the exchange notice, the W-2 reporting, use as an opportunity to get the correct information out there and dispel some of the rumors out there with the media and some of the chatter that's going on in the organization by using some of these as a positive to get the information out there and what the employer is doing. So as Michelle mentioned, if you guys have like 70 employees and you're on an Excel spreadsheet and that you're going to have to consider looking at using an HRIS, that's going to be very, very true in the years ahead. Considering HRIS or benefits enrollment or payroll with light HR is going to be imperative for your future requirements at any size over 50, because all of this large employer mandate reporting is all over the size of 50. And the electronic distribution option can actually help you as well with some of the other required notices. So if you have an HRIS system that you can at least get the reporting done, and you can also focus and tailor communications based on the information you have in your HRIS, then you can also disperse some of this information electronically as long as you have some of the proper pieces in place. So as you talk about HRIS systems and employee websites and all of these ERISA required documents, there's a lot of paper going around. So if you can get all of your employees that don't have work-related computer access to sign an affidavit stating, I actually am okay with receiving this information electronically, you can use the social media sites, the websites, and things like that to disperse this information. But thinking about technology in your workplace now as a large employer is going to be something you're going to need to put on your budget list. And we like things like HRIS systems and information coming out of like Paylocity has a light HR, UltiPro has a great HRIS system, but it can't be on spreadsheets anymore. It's going to be really difficult, so you want to really consider, and anyone on the Filice compliance team can help you kind of look at those HRIS systems. The picture I have here is really something I found is the top 10 HRIS systems out there. Happy to send it to anybody that's interested in taking a look at that report. So all of the required notices, the SPC, the exchange notice, the SPD, we can list them all under the benefits umbrella. Those can all be given electronically as long as that employee has work-related computer access, meaning they sit down at a desk with a computer and they receive emails from the organization as part of their communication. If you have employees that don't have sit-down work-related computer access, there is an affidavit form that can be distributed and have all of your employees sign. So whether that's during an open enrollment period or a mailing through the home, and then as you receive the affidavits, and all it's saying is that I understand that I can get all of these, and you list out the documents under the benefits umbrella are listed somewhere on your website or somewhere on the intranet or whatever it is that you use, or Filice Benefits website, that they can have access to those notices and that information there. But at any time I want to receive a paper copy, I can, and it gives the HR contact. So you want those all in place for all your current employees, and going forward, you want to make that as part of your onboarding process for those types of employees. Okay. Okay, so other considerations and best practices. So we talked a little bit about strategies going forward, and consumerism and account-based plans are probably going to be something that you definitely take a look at if you haven't already. Obviously, they're not mandated by any healthcare reform rules, but it's definitely going to be a cost-saving strategy going forward. But with these types of plans, communication year-round is key, because this really does change the whole landscape of how benefits are offered and how benefits are used. So you want to think about, if you're going to put one of these high deductible health plans in place, you're trying to teach that employee to be a better consumer of healthcare. Therefore, ongoing communication is imperative. Focus on how the plan gets used when delivering the information around open enrollment if this is new to your employees, as opposed to just the coverage and cost, because it does make a big difference if they know how to use the plan as well. And then pairing these types of plans with wellness initiatives and programming can be really beneficial. But if you do have wellness initiatives and programming, you're going to want to be really careful about how you communicate the wellness, and that you don't want it to sound discriminatory in any manner, because a lot of employers are actually utilizing these consumer-driven health plans and wellness programming to fund some of those high deductibles. So when you're communicating wellness to your workplace, you want to include the entire population, regardless if they're on the benefit plan or not. You want everyone having a healthy outlook on life. You want everyone to have a productive work day. So really embracing that entire population when it comes to wellness. Offering reasonable alternatives for all individuals who can't meet certain standards. So if you're tying any reward around the benefits program to any activity-based programming or health outcomes-based programming, there has to be reasonable alternatives in place for those members that cannot meet those requirements, and that reasonable alternative statement must be in all of your communication materials and must be visible to the employee. ACA came out with new regulations around wellness program, which had to do a lot with the reasonable alternative standards. Also, in addition to that, if you're having a health outcomes-based program, meaning that you're establishing a program around health criteria, so for example, someone gets an additional $200 in their HRA if not only they participated, but they have healthy measures, meaning normal BP, normal cholesterol. You can do that and tie rewards to that, but the reasonable alternative standard has to be there. And that type of plan, anyone that cannot meet those standards has to come up with another way to meet that reward, and you cannot ask for a doctor's physician statement when it comes to an outcomes-based plan. So that was the new thing in the ACA regulations that said for activity-based, you can say, do you have a doctor's note? But in outcomes-based, you can't ask for a doctor's note. So when you're talking about cost and new strategies and consumer-driven health plans, really try to figure out a way to frame the cost discussion. Because a lot of people say the consistent theme is costs are increasing, therefore your costs are increasing. And then they kind of leave it at that. But really what you want to focus on is what that means for the employee and their families. And try to pick a positive thing about the plan change, or about the strategy plan, first and foremost, as opposed to coming off right out of the gate as costs are increasing. It's really important to stay away from terms like skyrocketing cost and double-digit inflation, and it just creates a lot of anxiety to that employee. So what do we want to accomplish when we talk about benefits communication? We want to obviously paint the big picture, what it means overall to your employees, and actually individuals, so tailored communications can be very helpful. We also want to make sure that we're updating all of our documents and all of the places where those documents reside. We also want to talk about really developing a strategy around ongoing communication. So painting the big picture. So little benchmarking down there, that the company's communication material is very easy and to read and easy to understand. And when that's in place, you have more than 52% in engaged employees during open enrollment. And when it's not easy to understand, according to this study, there's only about 23% engagement. We obviously know that health benefits are going to change over the next decade. Prevention will continue to be a focus, so important to note to employees that how health and wellness is very important to the plan and the strategy itself. We also know that more limits and exclusions will be going away. Many aspects of the law will help equip that employee to be a better consumer. and a better shopper. So again, your communication materials really need to match what that big picture is all about. Your ERISA requirements, we talked about all of the mandated notices, the SBCs, the exchange notice. Also, in addition to all of that, your summary plan descriptions need to be updated, your HIPAA notice, all of that. But more importantly, where do all of those things reside, and where is all of that wording? So your benefits brochure, your new hire packet, your enrollment packet, your intranet, your employee handbook, all of those messaging and all of that eligibility criteria, is it all the same in every single place? Because the DOL audits are on the rise these days, and this is exactly what they're looking for. So if you don't have your SPD there, or your SPD may say some eligibility that was maybe 2 years ago, and now your new eligibility for this year is something different. So you want to make sure that all of the pieces fit together and they're all consistent. So I mentioned it a couple times already, plan for ongoing communication. I can't stress it enough. There's open enrollment is just the beginning, and furthermore, open enrollment, they're receiving all kinds of information. And again, when we talk about 20-minute increments or snippets, small, focused, tailored communications, there's too much going on at open enrollment. So follow-up communications, monthly is probably too much, but quarterly and on at least is probably a really good start for communicating benefits out there. And you can just take little simple subject matters throughout the year to present to your employees. So when you use social media, you only have like a few sentences that you can actually put out there, like if you're tweeting, or if you have Facebook, or if you have a blog. It's not like you're writing these big, long communication brochures and you expect people to read, 5, 6, 7 paragraphs. They don't. They read the first paragraph, costs are increasing, and then they're like, oh, I'm done reading that. So little short snippets focused on results. What is a deductible? What is the exchange notice all about? What does it mean when the media says silver, bronze, gold, platinum? Little things like that you can just get out there on a periodic basis is really good information for employees, and know that you're actually on top of it. Again, aligning all your communication and looking for those barriers. So if you say, well, they don't listen, or they don't read it, or they're not tech savvy, attack all those barriers and get behind those barriers and see what you can change to make it work for you. Easier said than done, I know, but there's some samples here about the Filice app that you can have on everyone's phone. There's also blogs that you can create for your employer. There's a Facebook page. A lot of those things are tweets that you can do. There's also companies out there that, for a small cost, you can actually set up a texting communication strategy. So you actually pick up the cost of the texting. It's really minimal, but you can send text every once in a while to your employees about different topics, something to look into. So when you address employees with the clear and simple information, you're going to get a lot more engagement and a lot more fostering of trust throughout the organization. This is another MetLife study about communicating often. When this employer group said, or employees say, my employer communicates benefits throughout the year. When this happens, you see about a 41% increase in engagement, and when it doesn't happen, you only see about a 20% engagement around open enrollment and around benefit meetings. So again, really important to develop a strategy that has an ongoing communication plan. Another piece to this study is that 61% of engaged employees, they actually say that they want to receive confirmation of their benefits and information throughout the year, and about 60% of that, actually pretty much half and half, 61 and 60%, say that ongoing education could be extremely useful when deciding about how their benefits work. So the stats are out there, the information is out there on what helps and what works best. So consider that when you're looking to do your communication strategy. Is there ever too much communication? In my book, never. I don't think there ever is too much communication when you're talking about benefits, but I will say obviously there's too much communication around open enrollment. Reminders, updates, newsletters, real life scenarios. So, someone went to the doctor, they didn't realize that their preventive care visit was free. That's a really good thing to promote and a really good thing to remind people. Social media obviously can actually lower the cost of all of this paper that's going out, so using social media can really help get that message across. So what are your objectives? Are they going to go back after this and say, oh my God, we have a crisis, we haven't gotten anything out in 2 years, and all we've ever been saying is that costs are increasing? Or are you going to set some time aside in your busy day and figure out a way that you can do a change management effort around communication strategy? Using employee feedback can be extremely helpful. Some people get a little bit scared of that. They don't want to put a benchmarking survey out. They don't want to know how unhappy their employees are. They want to kind of hide behind the rock and just see if it passes. But it can be extremely helpful when using that information to communicate what your employees need to know, what they don't understand. And remember who you're talking to. Benefits are confusing for everyone here in this room, even for us, and we live it every single day. We're still learning. So imagine how your employees probably feel. Not only are they working, they're working probably lots of hours. They have juggling, family life and kids and financials and things like that. So think about that when you're developing your communication materials, because it really has to come down to pictures, snippets, small, focused, tailored communication. Almost, I always say, kind of treat your employees when it comes to communication pieces like we're all kindergartners. Because when we were in kindergarten, we had little snippets of information. It was like the letter, the word red, and then it was an apple. And that was like, oh, that's a red apple. I get that. I can understand it. I can see it, and I can understand it. So when you're looking at employee benefit communications, that's kind of the same philosophy that I like to apply. When I talked about additional resources, Michelle's got another slide too that she'll show you after the panel, but these are two of my favorite. This is a video that you can find on the Kaiser Family Foundation website. It's called the Healthcare Reform Tool. It's a really great cartoon that you can stick on an employee benefits website, or maybe if you have a computer or a flat screen or something in the lunchroom that you can play this video. It talks all about the everyday individual and what healthcare reform can do for them or not do for them. Basically, if they're individual or if they don't have, or if they have employer coverage. It's a great short video, and it's quite entertaining. My other favorite is called choosingwisely.org. This is a phenomenal campaign series that employers can use when developing their communication strategies. And most of it has to do with how you become a better consumer, how you become a better healthcare shopper, and also, more importantly, what to ask your doctor when you're going in for a lot of these routine visits, because there's so much overuse in the medical market that this is kind of puts the tool in their hands to kind of figure out, okay, doc, I know you're going to run this EKG, but have we done this or this or this, or MRIs and things like that. So a lot of good information. Again, not all at once, but you can use a lot of this for little snippets going out throughout the year. Next steps, get an update out now, if you haven't already, about some of the requirements, if you haven't done that. And also get an update out about how you're going to connect this to your overall philosophy of the organization, because benefits need to become part of that philosophy. Be real about cost. Don't hide behind it. People want to know the truth, but just use the appropriate words and descriptions and spin it so that you can find the positive in some of those new strategies. Determine your approach for the model notices. If you're going to add cover letters, how much information do you want your employees to have? And then again, social media is now and in the future, so I really consider using that going forward.